This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. When the pandemic began, the state of Connecticut worked to get individuals out of shelters and house them in area hotels. And that will continue this winter too. But what services exist to reach youth who are at risk? A survey by the Connecticut Coalition to End Homelessness estimated that last January, nearly 2,500 young people had unstable housing or had become homeless. Today, Where We Live, we talk with providers about efforts to reach youth and the challenges teens and young adults face. Are you a young person who has experienced homelessness, or do you know someone who has? Where did they turn for help? You can join the conversation, 888-720-9677. That's 888-720-WNPR. As always, you can share a comment on our Facebook page or find us on Twitter at Where We Live. On Zoom with me now is Richard Cho, CEO of the Connecticut Coalition to End Homelessness. Richard, welcome back.
Thanks for having me, Lucy, and Happy New Year.
Happy New Year to you. Also with us is Roy Graham, who works for the Coalition as the Youth Special Projects Coordinator, where he oversees the Youth Homelessness Demonstration Project. We'll learn more about that in just a couple of minutes. Roy, thank you for joining Where We Live.
Good morning, Lucy. Thank you for having me.
So, Richard, I'll start with you. I mentioned this youth count that your organization does annually, and recently you released a report on the 2020 count. Can you talk about how you and your team go out in the community to find young people at risk, and tell us more about the numbers?
Sure. So we've been conducting these annual counts since 2017. I think most of you know, and I think I spoke before about the annual point-in-time counts that we conduct, which actually go back to 2007, where typically volunteers across the state are mobilized, and we work with both homeless service organizations and volunteers, and we canvass the streets and also count the folks in shelters and report that to HUD. In 2017, HUD began requiring communities to start counting youth who are experiencing homelessness, understanding that youth who experience homelessness don't typically, experience homelessness the same ways as adults and families. They don't use homeless shelters as much. They may not sleep outside. Many youth are living doubled up or in other places. And so understanding that the youth were a hidden homeless population, HUD began requiring communities to conduct a separate method for counting youth. And so in 2017, we began conducting a week-long survey. Instead of doing a one-night count, we would do a week-long count. We'd go identify locations where we were likely to find youth, everywhere from schools and libraries to soup kitchens and other programs. And we would administer a survey to speak with youth and determine what their housing status was. So we've been doing that the last several years. In 2020, we conducted that towards the last week of January. And what that survey found was that we estimate that about 7,800 youth would experience either homelessness or housing instability during 2020. And of those, about almost 2,500, 2,462, we estimate would experience literal homelessness, meaning they'd be sleeping on the streets, in shelters, or in their vehicles, or in places not meant for human habitation over the course of the year 2020.
So, Richard, nearly 8,000 youth, as you mentioned, experience homelessness or housing instability in 2020. Break that number down for us. Is this an increase from previous years or a decrease? And, when we talk about the difficulty of reaching these youth to count them, just some of the questions you have and concerns when you saw that data.
Yeah, truthfully, it's hard for us to tell whether the number's going up or down because our methodology isn't solid. The challenge with counting youth is that we're conducting surveys where we're likely to identify youth who are experiencing homelessness. We tend to oversample communities where there's higher rates of poverty. And then what we do is work with a sociologist to actually conduct an extrapolation to determine what is the larger number. We actually surveyed 2,573 youth, and then from that number, we were able to do an extrapolation. But our methodology for that extrapolation changes from year to year. So it's hard to tell whether the number is going up or down. What we do know is that the number is a lot bigger than what other data sources would tell us, either through our annual point-in-time counts or our homelessness management information system data. And essentially what it tells us is that there are a lot more youth who experience homelessness than our regular data systems would tell us. And so what we gather is that the number probably stayed relatively flat from 2019 to 2020, and that of the youth, we're seeing a pretty significant number of youth who are under the ages of 18 who experience homelessness, as well as significant numbers of youth who are 18 to 24 who experience homelessness.
I mentioned Roy Graham is also with us, and he works for the coalition as the Youth Special Projects Coordinator. Roy, when you saw the data and you think about the people that you work with, again, that 18 to 24 range, what was your reaction?
Well, Lucy, thank you. I guess I wasn't too surprised because, youth they're a complex population, and they are also very resourceful. So they don't typically see themselves as being homeless, even though they may be house hopping and couch surfing. So, you're not going to see them typically, as the, regular, the profile of sleeping under a bridge or just, being on the sidewalk. They're going to be at a friend's house or somewhere else. So, as Richard said, the numbers cannot really tell the youth who are really experiencing homelessness or unstable housing. So, while the number seems like a lot, it is a high number. I was not surprised, especially given the fact that we realized that gap where youth are not really eligible for a lot of the programs, or were not eligible for a lot of the programs that could assist young people, such as the regular rapid rehousing programs, because they didn't meet eligibility requirements, or some of the other programs that would be able to assist them until the Youth Homelessness Demonstration Program came about to be able to assist, as well as other programs that we have now to assist them.
So tell me more about the demonstration project, Roy. So is this allocated federal money specifically to help youth at risk?
Yes, Lucy, it's a HUD federal program, and back in 2018, Connecticut was one of 10 communities across the country who were awarded this grant for 2 years, realizing that there is a gap, as I spoke previously about, that youth were not eligible for other funding programs to be able to assist them with housing and other services and resources. So HUD awarded Connecticut with this program, and it was initially a demo project, which is now a full program, and it was designed to assist individual unaccompanied youth and young adults between the ages of 18 to 24 to not only provide funding and financial assistance for security deposits and rental assistance, but also for other services and resources that would be able to assist you to be able to sustain housing, such as childcare costs or transportation needs, and many other eligible costs as well.
You mentioned, Roy, that people, when they hear that someone may be homeless, they think of someone sleeping under a bridge, and young people, especially under 18, they're going to be the ones that may be staying with a friend or hopping from place to place. But can you talk more about some of the reasons behind why we are hearing that an estimated 8,000 young people were experiencing housing instability or homelessness in our state in 2020? What are some of the factors that lead them to not have stable housing, and where they find themselves in a situation that they need help?
Sure. I mean, the number one cause we know as a factor is family conflict, but it's much more complex than that with young people. It could be family conflict, sure, but there could be economic reasons. There could be factors such as their sexual orientation. There could be abuse in the home. There could be religious reasons. I mean, so there are many other factors that go into a youth becoming unstably housed or homeless. Some households live by, different standards. Their environments are different. So, they may have other rules that are within the household that if the youth does not abide by, they could be put out and then have to, find a place which could be with a friend or another relative, but they can't stay there long term.
Richard Choi is also here with us, CEO of the Connecticut Coalition to End Homelessness, as we focus on youth at risk in our state. Richard, when we talk about this youth count that happened last January, obviously before the pandemic, and so tell us now that we've been living in this now for 11 months or so, I've lost count. What are you hearing from providers and from youth at risk of how they have been reaching out for help, or what's been happening in Connecticut over the last several months?
Yeah, I'm glad you pointed that out, Lucy, because we are, of course, releasing this report almost a year after the surveys were conducted. And frankly, part of that was just because of how much of our focus and attention has shifted towards the COVID response, which kind of drew our attentions away from finalizing this report. But yes, I think this report gives a picture of what youth homelessness looked like prior to the pandemic. And since then, things have obviously been affected because of the pandemic. Many of the locations where youth might have gone for help, whether that's, homeless shelters or programs or transitional programs or even libraries, many of those places have been closed. We also know that many youth, particularly minors, who are still students who experience homelessness or housing instability, as schools shifted to hybrid and distance learning modes, it became a lot harder for young people to be able to self-identify as someone who's struggling with housing issues, whether they're couch surfing or doubled up, because frankly, all those schools are federally mandated to identify homeless students and also accommodate their educational needs. It really often involves having the ability to have face-to-face contact. And so if students are not able to have a person that they can connect with, it's harder for them to be able to disclose the fact that they have housing issues and needs. One of the data points that we've seen from the State Department of Education is that the rates of students who are failing to log in and to show up for distance learning seem to be overrepresented by those that also experience housing instability or homelessness. Again, since the data is not great, it's hard to fully know, but what we do know is that there seems to be a strong correlation between students who are struggling with housing issues and not actually showing up and logging in consistently for distance learning classes. The other way that we have a sense of what's going on is through the programs that we administer. As Roy mentioned, we administer funding for shelter diversion and rapid exit. So we provide short-term, one-time financial assistance for many youth that organizations across the state are assisting. And through those, we get case studies, case stories of youth. And what we're hearing is that the pressures of COVID have been great on households, which have been leading to a lot of youth being either kicked out or leaving. We also see a lot of instances of abuse and domestic violence that are affecting young people as well. So those are the kind of the snippets of what we know are affecting and the additional challenges that young people are facing these days.
I wanted to take a call from Julio in Manchester here on Where We Live. Julio, go ahead.
Hi, good morning. Thanks for my call. I was actually meditating this morning about the idea of awareness. So thank you so much for bringing awareness to this. What happened?
Thank you, Julio. Go ahead. Julio, you're there? Julio, thank you for calling in. Again, the work that Richard and others are doing to help people at risk is very important in our state. And something, Richard, I wanted to go back to you on. You mentioned that the data on minors, especially that are at risk of housing instability or being homeless. Something in your report that really struck me is that it said that there's not a singular system to track minors in our state. When we look at the multiple departments, whether it's DCF or the Department of Correction or the Department of Education or DMIS, it's kind of mind-boggling to think that when we know that there are people at risk and they're away, especially if they're youth, why are these state agencies not communicating in a way that can make it more successful for them to reach these children, Richard?
Yeah, and I wouldn't say that they're not. I mean, they all are doing their part. The problem is that there's not a singular agency that has the full picture. In a sense, youth who experience homelessness are the ones who fall through the cracks between all of these systems. Some of them are foster care involved, so DCF may have one sense of their picture. Mm. Again, some of them are students, especially if you're under 18, and therefore the State Department of Education might have some data on them. We track use of homeless services, primarily shelters and homeless outreach programs. So we have another kind of slice of the picture, which are youth who actually formally use homeless services that were originally intended for adults. And Department of Mental Health and Addiction Services has a number of programs for youth. But again, there's not a single system that sort of encompasses youth homelessness. And so everybody has a different part. It's sort of like the parable of the elephant in the room and in the dark room, and everyone's touching a different piece of it. I think what it takes is a collaborative effort across those systems and working with the private sector and municipalities to really get a full picture of youth that are experiencing homelessness. It sounds cliche, but it really does take a village to not only identify youth, but also to assist them. And so a lot of what the youth outreach and counts that we've been conducting are just that. It's about how to bring that village together. And we've done that thus far on a week-long basis every year. What we're trying to build towards this year actually is to say, like, we've done this and we've proven that we can come together as a community across multiple systems on a week-long basis. Let's figure out if we can get that to be year-round and pull together the collaboration. So one of the things that we're in conversations with lots of agencies and organizations about is how do we make that village work year-round to identify youth? And so that's something we're working to. I want to quickly mention, we just launched this week a new municipal campaign, which we're calling My Town Cares, in partnership with the Connecticut Conference of Municipalities, where we're calling on all 169 towns and cities in Connecticut to do their part to end homelessness, to pass a resolution of support, as well as to identify a point person. And one of the things that we're asking towns and cities to take up is to assist us with that data collection. And so become part of that village year-round that can help us identify youth.
That's Richard Cho, CEO of the Connecticut Coalition to End Homelessness here on Where We Live, as well as Roy Graham, who works for the coalition as the coordinator for the Youth Homelessness Demonstration Project. I'm Lucy Nalpathanchel. Coming up, we're going to talk to a young person who's working to help her peers that have experienced homelessness or unstable housing. And you can join us too. 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We're talking about young people in our state who experience homelessness or unstable housing. A recent report by the Connecticut Coalition to End Homelessness finds thousands of youth in our state are affected. You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Roy Graham is with us on Zoom. He's the coordinator of youth special projects for the Connecticut Coalition to End Homelessness. And joining us now is Diamond Lovette. She's a member of Youth Action Council. That's part of the Coordinated Access Network for Greater Hartford and Central Connecticut. Diamond, welcome to the show.
Thank you, Lucy. How are you today?
I'm doing well. So I mentioned you're a member of the Youth Action Council. So tell us about this group and how did you become associated with it?
I was somebody who experienced homelessness myself, and I was recommended to start working with them because of my experience. They were looking for somebody with experience in the system and basically getting their perspective, and that's what we are. As the Youth Action Council, we are individuals who are able to provide a voice and perspective to youth homelessness and housing instability from our personal experience.
And Diamond, because we're talking about this report looking at 2020, from your lived experience, when you hear that there are nearly 8,000 young people that are either homeless or are experiencing unstable housing, why do you think that what has led them to be dealing with this? Like, what are some of the factors and the gaps in helping them?
I think that there are a lot of gaps and there's a lot of factors, and I think that's why there's so many of them, because not all of them can be fixed by just one problem. A lot of the people that I was in the system with, I actually was very fortunate enough to when I called 211, I was in and out of a shelter and placed into an apartment within 2 months, which isn't a story for a lot of people, but I was fortunate enough to have that story. However, in comparison to my fiance, he's been stuck in a loophole in the system for 4 years where he can't get ID because you have to have a copy of ID to get ID. And he was in the same program as me at Friendship specifically, Friendship Service Center. And then when COVID hit specifically, it just kind of messed everything up and he's back in the same place after 4 years. So I feel like it's kind of set up to help. Certain people do get through. Like, it does help a lot of people like me because I do have all of my IDs. I do have everything. Like, I can handle money pretty much well, but not a lot of people can. So I feel like it's set up for a certain candidate to get through, and a lot of them don't.
So Roy Cram, respond to what Diamond shared. She mentioned the ID, some young people not having ID, so that probably prevents them from being able to be eligible for certain programs. Can you talk through that with us? And it sounds like Diamond, when she called 211, she was able to be connected to services, but not everybody even knows to call 211. And so can you walk us through some of the gaps?
Sure. And thank you, Diamond, for being here today and lending your voice and bringing that up because, she's exactly right, because it's more than just providing housing or providing rental assistance. What people are actually looking for is beyond that is knowledge and information and who, what, where's, and hows of how to navigate through this system. And so being able to make people aware and be able to get them information is part of the gap that we're trying to fill now, as Richard has spoken about earlier with the municipality campaign, just to get awareness out what young people should do, where they should go, who they should connect with, and something like IDs. I mean, of course, with COVID, a lot of agencies were not open, so people could not go there in person to get IDs. So, finding out information about that, how they can still obtain an ID. Unfortunately, there are not every youth comes through with the same challenges. Some have challenges that are more and beyond just getting identification. So it may be harder or take longer for them to be able to get stabilized. So that's some of it as well. So none of this is cookie cutter, Lucy. So it is quite complex. And, so the more people and more agencies and more community partners that we can get involved, with this will absolutely try to assist in filling those gaps, as well as, training and more technical assistance that, could be provided to folks and staff out in the field, which the CCEH, the coalition, also does as well. So while we're certainly making progress, there's still obviously a lot of work yet to be done.
Diamond, I wanted to go back to you because it's important that people hear that there are programs out there and there are people willing to help. But what about just the issue of trust? When you talk to your peers, whatever struggles they may have had, is trust a factor where they feel comfortable leaning on an organization or a provider that's trying to help? I'm just wondering if you could talk us through that.
Absolutely. I think trust is a very, very, very serious factor because for me, I could talk about my personal story because I have a lot of people involved in my circle. When I was homeless, I ended up moving into an apartment with my cousin, and she was along with me in the shelter, Friendship Service Center. And I was fortunate enough to have a room, and without getting too detailed, I feel like I'm built pretty okay. Like I'm pretty tall and I could handle myself, and she's pretty small. And she felt like there was a hierarchy of bullying from even though it was a youth shelter, that the older youths that would still be technically considered adults know how to take advantage, or even some of the people in the shelter aren't really like applying structure as they should because they have relationships with these adults and they're not really protecting the youths. So the youths just feel the need to go elsewhere to feel safer, when I think Friendship is a really great place for resources, but I also think it's really crowded by people who aren't really taking advantage of the resources.
Roy, can you respond to what Diamond shared? And we keep talking about shelters, and that's just one conduit for help. For a young person that doesn't have a place to live, talk us through the plan in place. So they may go to a shelter first, but then what happens?
Well, I mean, the first option, Lucy, is we want to keep people out of shelter as much as possible. I mean, shelter, we would like to keep as the last resort. We like to use shelter diversion as a process to try to keep folks out of shelter. And that is not saying that we're trying to deny folks shelter, because there are folks who actually will need shelter. But the first course of action is to keep people out of shelter. And the second piece of that is that when folks are in shelter, there are, youth navigators at agencies which that will assist the shelters in working with folks. And Friendship Service Center is just one of the few shelters in the state of Connecticut that actually are designed for youth and young adults. That again is one of the gaps that we're looking at now when we're talking about young people. Most of the shelters are adult shelters, so that's another reason why we try as much as possible to keep young people out of shelters, as was just brought up by Diamond, that there can be some adverse effects, such as bullying may be one of them. So shelters are not the place for young people. So we try to do our best to keep them out of shelter. And then, the shelter staff works with other agencies and other folks within the CAN, such as youth navigators, housing coordinators, or other case managers, to help get those young people out of shelter as quickly as possible.
You can join our conversation as we focus on youth homelessness. With us today on Zoom, Roy Graham, coordinator of youth special projects for the Connecticut Coalition to End Homelessness, and Diamond Lovette, a member of the Youth Action Council that's part of the Coordinated Access Network for Greater Hartford and Central Connecticut. Julio's calling back from Manchester. Julio, what did you want to share?
Am I coming through now?
Yes, go ahead, Julio.
So, one thing that I was amazed to learn about as I started to work with youth for the Department of Mental Health is the levels, of complexity, as he mentioned earlier, that this issue has. I know of clients who have had a lot of trouble with squatters. And so, for one, it creates a situation in their homes where they can be, their safety can be at risk. Their housing is, of course, at risk. So it's housing insecurity, and it's being caused by another person's housing insecurity. So it's an amazingly complex issue when you really decide to look at it.
Well, thank you, Julio, for sharing that. Roy, how do you respond to our caller?
Hi. Julio's absolutely right, where we have situations where folks, people have someone, it could be a relative, who they don't want that person to be out on the street or to be sleeping in their car, and this person has an apartment but that apartment is associated with some kind of voucher, and so the lease only will allow for that person who is actually attached to that voucher to be in that apartment. But then that person doesn't want their relative to be on the street or go into shelter. So then they bring the person into the apartment, and then it provides that challenging situation that Julio just talked about, because this person is putting their own housing at risk to ensure that their relative or their friend, their loved one, isn't on the street or in shelter. So you have two people who are in a housing situation that is at risk, but it also sometimes could lead to two people now who are now unstably housed that could become homeless. So it is really complex. And some of the times you can get creative and maybe talk to the landlord and say, well, could we add this person to the lease? Or do you have a bigger unit, say a 2-bedroom unit that we could move into? And then we could, draw up another lease that would have both of our names on it. So that's another way that you can go about it. But it's, he's exactly right. It can be complex, and, it jeopardizes both people potentially.
Diamond, the state General Assembly is meeting this week, starting up their regular session. What do you want state lawmakers to know about your lived experience, what you're hearing from peers who've either experienced homelessness or unstable housing? How do you want to see these gaps addressed? What do you want them to see them tackle first?
I think I firstly want to see them tackle the structure first. I think awareness is actually a really good point, because before I was homeless, before I called 211, I didn't know that I could call 211. I thought that that 211 didn't have services for me. Admittedly, all of my assumptions were that, like, if I went to a shelter, that I would be like robbed or something, or the worst would happen, and just to stay far away from shelters. But it also kept me far away from probably the best help that I've ever received in my life. And it does keep people away from really good help. And I think that getting people to know about these resources is a really good point, but also the structure of making sure these resources are being used properly would also help people get through a lot better. Because again, at my personal experience at Friendship Service Center, there were like people who were on a wait list online. There were empty rooms, and the staff just not putting people in there. There were people who had been there for way longer than they should have been there, but just because they didn't want to leave the comfortability of like having access to the soup kitchen and lights and Wi-Fi and stuff like that, they had like staff helping them out and stuff like that. So it's not that I don't understand and stuff like that, but the structure keeps a lot of other people from like getting help. So I feel like putting a great amount of structure in place would keep more people getting help. And if you keep in the progress that you're supposed to be on, there would be no reason for you to fear getting kicked out of friendship or something like that. If you're on the process to getting everything you need and getting an apartment and becoming self-sufficient, there is no need for the fear.
And Roy Graham, before we end here, I wanted to ask you the same question. Is it more resources for caseworkers to help youth at risk?
Yeah, one of the things, I mean, we are constantly revisiting and reevaluating the structure that Diamond is speaking of. Youth voice is definitely one of the things that we look for, because we want to understand from their perspective what needs to be changed and what we should be looking at. And as we talk about, within this industry, within this structure, there is staff turnover, and quite frankly, the pay, the economic scale is not quite where we would like it to be, which may cause some of this turnover. So I think that that's something that we're looking at as well, where we can provide how staff can be provided with that better pay scale in order to either make it more of a career path, career development path, or how we can better support the staff so that we don't have the turnover, so that they can assist with young folks better, as Diamond stated.
Roy Graham, again, is the coordinator of Youth Special Projects for the Connecticut Coalition to End Homelessness. Roy, thank you for your time.
Thank you, Lucy. It's my pleasure.
And Diamond Lovette, member of the Youth Action Council. Diamond, thank you for joining us today.
Thank you, Lucy.
Coming up, we're going to hear from a provider in the northwest part of our state, and you can join us too as we focus on youth homelessness. 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're focused on youth homelessness in our state. Joining us now on Zoom, Gabrielle Padilla, coordinator of housing services through Mental Health Connecticut. Gabrielle, welcome to our show.
Hi, how are you? Thank you.
We heard from a young woman who talked about her lived experience and some of the gaps that she sees. I understand you serve the northwest region of our state, and so I'm wondering, with the youth that you're working with, what gaps do you see or barriers for them getting the help they need?
Yeah, thank you, Lucy. So for us, for the Northwest CT region of the state, we service the greater Waterbury area up to the Litchfield County area. And, youth services vary throughout our community. Obviously in Waterbury, where it's a larger city, more resources are readily available to youth versus up in the Litchfield County area, where we're a more rural area. And so resources are a little bit more scarce, and barriers such as transportation also present themselves. And so the overall connection with youth creates more of a barrier in that sense. And it's harder for my staff, or the navigators, to be able to kind of get out there and to network and connect with them in that outreach way, to make sure that they are getting the appropriate services that they need. In addition, in our region, as Roy had mentioned earlier, there are only a few shelters that are youth focused. And unfortunately, in our region, we do not have a youth shelter in that area. So when a youth does present, it is intimidating for them to want to enter into shelter. However, I can say that our shelter staff really make every effort to make the youth feel welcomed. when they're coming in, and to make their stay at the shelter short and brief.
So how has COVID exacerbated these barriers, Gabrielle?
So COVID has been pretty interesting. In some ways, COVID has kind of been a help in the sense that during the pandemic, during our shutdown, the perks that COVID kind of gave us was there was free Wi-Fi. So youth were able to kind of tap into these hotspots. And so we were able to kind of service them more remotely in ways that would have been more of a barrier. In other ways, though, it was harder for us to kind of go out and to meet with them face to face, as when we would go out into communities such as the libraries, such as, coffee shops like Dunkin' Donuts, or, if we went to McDonald's, we can no longer go there and sit in a place and have those conversations with them. You can't go to a mall and meet them there. So though, in that sense, it created more of a barrier in that way to have that face-to-face contact. Our youth navigator in our region did a really great job in being creative. We had expanded our time of availability for the youth. They now can meet us 5 days a week from 9 to 5, where before, prior to COVID, we had set scheduled dates and time frames for when the youth could connect with the navigator. So we've expanded our service time for them. And, we are going out into the community, meeting with them, but we try to do as much as we can through virtually, through, FaceTime, Zoom, adding wise to kind of get connected in that way and providing them the resources that they need as we best can during this time.
So Richard Cho, I wanted to bring you back into the conversation, CEO of the Connecticut Coalition to End Homelessness. Respond to what Gabrielle has shared and how not all places in our state have as robust services to help people at risk, especially young people.
Yeah, well, that's certainly true. And in places like New Haven, in places like Hartford, you tend to have more services in general for young people. COVID's had an interesting impact in that a lot of day programs or locations where youth might be able to find help during the day have been either closed or limited in terms of opening. And so in a way, I think what the pandemic has done is help reinforce this message that there's ways to get help that don't require coming to shelter or an in-person context. And as Gabriella mentioned, we've been able to move a lot of our intake appointments for our homeless system, whether on the youth side or for adults or families, to virtual appointments via a 211 call. And so that's actually opened up the possibility to get help from a lot more people who simply just need access to a phone, which most people seem to have. And so that's been a good thing. I think what we're trying to do is build a system where we don't have to send people to shelter or a program in order to get help, but where the first thing we can do is conduct a problem-solving conversation with a youth where the goal could be to try to help them stabilize their housing situation. We actually administer funding that we receive from HUD through the Youth Homelessness Demonstration Program that enables us to provide financial assistance. So if youth need some help finding their own home, we can help with security deposits or rental assistance. We can also often pay for other flexible needs that enable youth to stay with a safe situation in some cases. So, again, we're trying to reinforce that message that there's ways to address homelessness that don't require coming to shelters programs. And I think what we built.
Richard, earlier you mentioned this collaboration with point and time count starting up, where you're going to be working closely with municipalities versus relying on volunteers. Can you talk more about that and how that will help address what we just talked about?
Yeah, so we're required every year to do this point in time count, which, as I mentioned before, primarily focuses on adults and families. But typically we mobilize close to 1,000 volunteers across the state to go canvass the streets in partnership with homeless outreach workers and homeless services staff. Because of COVID, we thought we couldn't do that in a way that is safe. So what we've decided to do instead is to rely on the expertise of homeless outreach teams to help identify places where people who are sleeping outside might be identified. But in addition, we're hoping to leverage the expertise of municipalities, who often are the kind of first line of response to knowing where people are experiencing homelessness, whether because police or fire departments are called on the scene. They typically know where to find homeless encampments or places where people are sleeping outside. And so we're in a way kind of turning a crisis into opportunity, and using the point in time count as a way to really strengthen our collaboration with municipalities. And as I mentioned, this partnership with CCM, where we are actually formally launching a campaign to try to enlist towns and cities across the state to do more around homelessness, is something that we're kind of tying this into. So we're very excited about the potential to potentially have all 169 towns and cities commit to our goal of ending homelessness, starting with helping us with identifying people who experience homelessness through this year's point in time count at the end of this month.
Gabrielle, we just have a couple of minutes left, but I did want to turn back to you when we think about the barriers that you're seeing in your region. You mentioned mental health and providers. This legislative session starting up this week, what do you want to see lawmakers address to help the young people you're serving?
For myself, as Roy had mentioned before, this is a complex population, and on our end, we follow the housing first model, but as we all know that housing is just one part of the solution, and that there are other needs and barriers that are identified when anyone is coming through our system, and we try our best to try to prioritize those other identified barriers, such as medical, mental health, substance abuse, life skill trainings. As to what even Diamond had said herself, is that for her, she felt she kind of had, for her, she was kind of that mold to be that success. But for other youth, they needed a little bit more of that additional support. And I think for what we would like to see is that those supports become more available and easily accessible for the youth, in order to have their housing and their overall crisis just to be able to be resolved in an overall success and sustainable as well.
Richard, again, just a short amount of time left, but when we think about the upcoming budget process and money to deal with big deficits, are you worried about nonprofits not getting the support they need?
Absolutely. I mean, I think we'll be advancing our legislative agenda in this upcoming session. And the top priority that our members spoke about is the need to make sure that they have adequate funding to be able to pay frontline staff. This year it's been really clear that people who work in the homeless services sector are considered essential workers. They've been critical to helping protect not only people experiencing homelessness from COVID outbreaks, but the general public as well. And so, but one of the things we experienced is declining rates of funding, which has not enabled them to pay their frontline staff, which is also a racial equity issue, because so many of the people who work on the front lines of our homeless service system are people of color. And the fact that we've not been able to pay them adequately, the fact that there's high staff turnover, that we've not been able to invest in their development is a real, I think, tragedy. And so we're hoping to try to address that through this session.
This will be a topic that we'll return to here on Where We Live. I want to thank Richard Cho, Chief Executive Officer of Connecticut Coalition to End Homelessness, and Gabrielle Padilla, Coordinator of Housing Services through Mental Health Connecticut. If you are struggling and you need help finding housing or any kind of service, you can call 211. I'm Lucy Nalpathanchel. Today's show, produced by Carmen Baskoff.